everybody, welcome to Just Upright. My name is Doc Jane Ruder. I'm a doctor of physical therapy and I'm a certified dementia practitioner. So if you are new to my channel, thank you for watching. And also I'm very excited to share with you guys that I have published books on Amazon. They are so beautifully designed and I will show them to you right now. So if you go to amazon.com and you type in my name, Ginalyn Ruder, Ginalynruder, enter that, and then it will take you to this page. It will say, did you mean Ginalyn Rider? So you don't click that. So it will show you the books that I have published. I have the Mandala Adult Coloring book. I have the Just Upright book, another mandala coloring book. I have the handwriting practice notebook for kids, teens, and adults. You know, this one like a blank handwriting notebook. I have this beautifully designed monthly planner, 2022 monthly planner, elegantly designed recipe notebook, journal, daily planner, roast, beautiful pink roses, notebook, the PT Path to US, another journal, Life is Beautiful journal, It is Well with My Soul journal, Note to Self journal, this unicorn, very cute unicorn notebook, the practical tips for therapists prior to migrating or starting your US practice. Sorry about the noise. And this is another monthly planner, 2022 monthly planner. For Japanese friends and those who want to learn how to write the kanji writing, Japanese writing, I have this kanji practice notebook. For engineers, mathematicians, designers, I have the isometric graph notebook, cursive handwriting workbook, another kanji practice notebook. If you are a designer or a sketch artist, I have a sketchbook for you, another monthly planner, 2022 monthly planner, and Japanese writing practice notebook, guitar tablature notebook if you're an artist and you have lyrics in mind that you want to put down, pre-writing skills workbook for preschoolers, okay? And another planner, 2022 planner, cursive handwriting workbook, dot grid notebook, another cursive handwriting notebook, a journal, Be Still journal, very beautiful My Cute Unicorn colorful notebook 6x9. So those books are available at amazon.com. Again, just type my name, GINALYN and everything will pop out. There are more to come. So those, for now, those are the ones available, but more to come. And I appreciate you supporting me and this channel by buying those books or notebooks that you can use for school, for arts, for hobbies, and whatever you have used for notebooks or planners or journals. Thank you so much. Check those ones out, and they are very affordable priced, okay? All right, so for today, I'm going to discuss the pros and cons of working in hospital setting for therapists, may it be physical, speech, or occupational therapists. This one is for you. This is a part of the series that I'm making about the pros and cons of different practice setting or facilities where you can work as physical, occupational, or speech therapists here in the US. So again, these are compilations of answers from colleagues when I asked them about the pros and cons of working where they are or where they were working before, and I compiled their answers. So each experience is unique, okay? So some of this may not be true for you or for other people, but again, this is in general, and there's always exception to the rule, and there are a lot of factors affecting the pros and cons depending on what state you're working, and especially what company are you working for, what hospital you're working. There are so many factors affecting the pros and cons. So this is just in general. Okay, so let's get started. Actually, saying working in a hospital is a broad term because if you're going to work in a hospital, some hospitals or majority of hospitals actually have an acute rehabilitation, and it is separate from an inpatient rehabilitation. So I found this from HudsonViewRehab.com, and this is just in general definition. What is an acute rehab? So acute rehab are for patients who experience major medical trauma and need serious efforts to aid in recovery. So some patients may have a stroke, major surgery or amputation, and may be dealing with serious illness. Most of these patients will not be able to fully recover without the aid of intense therapy and medical assistance, and would not be able to recover in reasonable amount of time. Acute care patients usually come straight from hospital, opening up beds for patients who need medical help, and they come to rehab when they are stable but still need a tremendous amount of assistance, and they wouldn't be able to receive in a home setting. An acute stay is usually not long, since the acute, quote-unquote, acute portion of the rehab moves to a lower stage of rehab when the patient is progressing. The acute care patient has 3 to 5 hours of therapy every day with a mix of speech, physical, occupational, and other acute therapies such as respiratory therapy or electromagnetic therapies. The patient is seen by a physician or a team of physicians every day to mark progress, to make recommendations for continuation of rehabilitation. Acute patients are expected to make fast progress and move up a level out of acute rehab. So I found this table just to differentiate the acute rehabilitation from an inpatient rehabilitation facility. So we're just going to focus our attention here, okay, on this table. So as you can see, the focus on inpatient rehabilitation facility is restoration of functional independence, and the anticipated length of stay is 15 to 20 days. Program for medically complex patients, no. Program for patient requiring ventilation weaning, no. 24-hour respiratory therapy, no. Telemetry monitoring, no. Daily physician visits, yes, by the physiatrist. Program for rehabilitated services, yes, must be able to progress to 3 hours per day. Brain injury specialists, some. So as you can see, based on the definition of an acute rehabilitation from an inpatient rehabilitation, there is some differences between the two. Acute rehabilitation, as the name implies, the patient is like just got out of surgery, just got out of a major complication, medical complication. Okay, so acute, very acute condition. In an inpatient facility, it's a short stay, but the patient should be able to tolerate 3 hours of intensive therapy so that they can go to the next level of therapy. It's either they can go home if they are independent and safe enough to go home, or they can continue to a skilled nursing facility, short rehabilitation stay, or if they are not really able to recover and be safe to be home on their own and without caregiver, they can transition to a skilled nursing facility. So different patients, different destination depending on how they progress from therapy. Okay, so now that we have it down, let's go ahead and discuss the pros and cons of working in a hospital setting. So according to colleagues, one of the most common pros or advantages of working in a hospital setting is you are exposed to wide variety of medical conditions, so medical or surgical conditions. So you can have wide range of experience managing different conditions, from stroke, brain injury, spinal cord injury, neurologic conditions, GBS, Parkinson's disease, wide range of orthopedic conditions, motor vehicular accident patients with multiple orthopedic conditions, fractures, dislocations, status post surgery, knee replacement, hip replacement, shoulder replacement, spine surgery, any other conditions such as cancer, Alzheimer's disease, and other various medical conditions. So this is rich when it comes to experiencing management of different conditions of the patient. So it is good, especially when you're starting. It is a good exposure and a good training on how to manage wide variety of patient condition if you're working in a hospital setting. Okay, so that's the number one advantage of working in a hospital. So other colleagues also mentioned another advantage is no weekends or major holidays. Okay, no weekends or major holidays. So maybe it depends also on what hospital you're working, what company you're working for, and what are their policies regarding weekends or holidays. Okay, and then another thing, I have an inpatient hospital experience. I did PRN in one of the major hospitals here in St. Louis, and so I get to experience the inpatient. I did not get to experience the acute setting. Okay, so in the inpatient, in my experience, I like the third advantage, and that is the multidisciplinary approach. Okay, the things that we just read on book when I was in college, like sit down meeting with the physiatrist, with the nurse, with the PT, with the OT if there's speech involved, with the social worker, with the case manager. So everyone involved in the patient care are there and giving short report on how the patient is doing and making decision what is best for the patient. So that is the interdisciplinary, multidisciplinary approach. So you feel like you are really part of the team and you're giving the report based on how the patient is doing with your discipline, like a physical therapy or occupational speech therapy. And they will base the decision based on how the patient is doing from nursing standpoint, from the therapy standpoint, social worker from the doctor, the physiatrist. So that is really good training to be working with different team members who are involved in the patient care. So those are the advantages of working in the hospital. So just a recap, you're exposed to various wide range of medical surgical condition that you can be trained on how to manage these conditions of the patients, and wide range of patient age, demographics, stuff like that. So another one is it depends on what hospital you work for, what company you work for. Some colleagues said no weekends or major holidays if you're working in the hospital. And then multidisciplinary approach. You are part of the team making decision on what is best for your patient. Okay, so those are the advantages. So what are the disadvantages of working in the hospital? So just like I said, I had an inpatient experience working in a hospital, inpatient rehabilitation. So one of the disadvantages is you're on your feet all day. So if you're working a full-time therapist in that hospital, so you're on your feet all day, from one patient to another. There is really no break in between patients. It's one patient after another. So I really come to realize that one of the most hard-working therapists out there are the hospital therapists, because they really are working so hard every day, one patient after another. So the schedule is really tight in the hospital. Okay, so again, it can be affected by the company you work for, their policies and procedures. So some colleagues said there are overlap of patients. So in my case, I did not have overlap in the inpatient setting where I work, but some colleagues said they had overlap of patients. Another disadvantage is no time consideration for documentation. Okay, so again, it depends on the company you work for, and it depends on their policies and procedures. So when I was working in an inpatient, I try to work with the patient, and when the patient is resting, I try to type as fast as I could, but accurate documentation on how the patient is doing or what I did, what are my interventions. And I try to complete my note while I'm with the patient, okay? So sometimes if the patient is really a one-on-one patient and you cannot really you cannot really do your documentation. Some colleagues complete their documentation during lunch break, okay, during lunchtime. So it is very hard sometimes to do really the completion of documentation while you're with patient who needs really a one-on-one attention, and you cannot just let the patient rest for a little bit or recover from the exercises and type beside the patient. So sometimes it doesn't happen, okay? So no time consideration for documentation. Some colleagues said that. Another colleague said late night schedule. So I did not experience that, but based on that person's experience, they had a late night schedule. Another disadvantage from one colleague said it's a low paying job. So again, compared to a skilled nursing facility or home health therapy, if you are a full-time, it may be a low-paying job. And another one disadvantage is lifting, heavy lifting will be involved in transferring the patient, and if you're working sit to stand, okay, transferring the patient from the wheelchair to the bed or from wheelchair to the toilet, there is a heavy lifting involved, especially during therapy and you're working in standing balance, okay, and especially gait training in a very debilitated, deconditioned, weak patient. So a very physical work, okay? So just a recap of the summary of the disadvantages that I got from colleagues. If you're working in a hospital, you're on your feet all day. Some of them reported overlap of patients, no time consideration for documentation, late night schedule, low paying, and it involves some lifting. So I hope that it was helpful for you to have an idea what it is like to work in a hospital setting. Please share this video and this channel to your sphere of influence so that we can reach as many people as we can to help them as much as we can. Thank you so much for watching and stay blessed. Thank you so much for watching. Please do not forget to hit the subscribe button below to be updated with the latest video releases. Share this channel to other people you know who will benefit from just upright videos. Thank you again and stay blessed.